The Middle East is a region rich in traditions, but it's also home to a growing breast cancer epidemic. Our Barbara Starr traveled to Jordan and found out that in fighting cancer, health professionals must understand the culture behind the care.
I remember it was Friday. I was in my room and I was taking my abaya, taking off my abaya, and just by chance, my hand touched my breast, and I felt a lump.
Samia Alamoudi, a Saudi Arabian obstetrician and gynecologist, has come to Jordan, a woman on a mission. Dr. Samia, as she is known, is breaking a taboo in the socially conservative Middle East. She is talking openly about breast cancer and her journey surviving the deadly disease.
Let us be very honest about it. It's a very critical and sensitive issue to a lot of families and a lot of women. And it's not something easy to talk about.
Women around the globe face the fear diagnosis every year. But here in the Middle East, many women shy away from even routine breast exams. Here, doctors say, too many women are not seeking life-saving medical care. Samia joined these women at this symposium in Jordan. Over a 2-day period, she's everywhere, putting up exhibits, talking to colleagues, breaking the silence about this disease. There are few reliable statistics, but because breast cancer is considered a delicate subject in this region, experts say only a small percentage of women go to the doctor in time to get diagnosed in the early, more curable stages. Dr. Mahmoud Sarhan, Director General of the King Hussein Cancer Center in Amman, sees the tragedy firsthand. He says a nurse here didn't get treatment even after being diagnosed last year. Now she is dying.
She went to the hospital because she started having back pain, not because of the lump. And the back pain was investigated and found to be actually a fracture of the vertebra because of advanced breast cancer.
Sarhan estimates a staggering 70% of breast cancer cases in Jordan are not even diagnosed until stage 3 or 4. By then, standard surgery, chemotherapy, and radiation treatments may be too late. As part of the effort to increase awareness about breast cancer, here at the King Hussein Cancer Center, women are given this card they can hang in their shower that shows them how to do a self-breast exam. The hospital is trying to deal with cultural sensitivities in its screening clinics and treatment areas. The close-knit life of Arab society, where many still live in small towns, can inhibit some women.
Some women, they don't want to discuss it even because of their husband. They think that maybe their husband, they will leave them because of this problem.
That makes it all the more remarkable that here in the chemotherapy area of the hospital, Arab women who have survived breast cancer are now openly counseling others. There is a sense of urgency. Here, some women are diagnosed in their early 20s, much earlier than in the West. Doctors say that itself is a concern, and more research is needed to determine if genetic or environmental factors are the cause. Still, the focus on early detection may be paying off. Now, at least 5% of the cases here are diagnosed at the earliest stage of the disease. For Dr. Samia, breaking the silence about breast cancer is helped by her deep, abiding Islamic faith, a faith she says requires women not to stay silent.
Even in Islam, we are asked to go and seek medical advice, go and seek treatment. And there is a punishment if we do not take good care of ourselves from God.
In another sign of progress, here at the King Hussein Cancer Center, they're setting up a support group for husbands of breast cancer victims, something really remarkable in this region of the world. Still, there's a long way to go. Doctors tell us there are many women who are still fearful and will not get the treatment they need. For Vital Signs, Barbara Starr, CNN, Amman.
The dangers of smoking are well known. Most people also know that
before the patient arrives. People focused, healthcare simplified.
Impact your world.
It is up to you to take action.
However you want to help.